Welcome back to Grey Ghost Outdoors. Today we are going through my first aid kits. Okay, first we're going to start with this small little kit over here. So this little kit usually lives on my belt or in my backpack. And it fits along the shoulder strap of my backpack. It clips there. And there's also these little MOLLE clips, MOLLE little bands on the back that you can weave into MOLLE or just clip around a belt or any type of thing that you could do that. I am a nerd, so it does usually live on me, but it's come in handy quite a few times. It is a Maxpedition pouch, and these are also Maxpedition straps. It's the smallest one. I really liked it. I've been wearing it for about a month or two now, and it's come in handy quite a few times. Actually, I've been wearing it basically the whole summer. So it opens like this. It doesn't open completely, but it opens so you could fan it out and see it all. In here, there's about 2 to 3 main compartments per se. In the first little compartment, I have a lot of basically my medications. First off, I have this. This is an anti-diarrheal tablet. I have 4 things of Benadryl. The general preferred dose is about 2 of these every 4 hours for an allergic reaction or most of the uses of Benadryl. So I keep 2 things in there that'll last about 8 hours. I like Benadryl. And also these are gel capsules, so if you need to get it faster, if the patient needs it faster, you can have them bite down on it, and that usually gets it into their system a little faster. Additionally, I have 2 packets of Advil. Each of these have 2 tablets inside of them. Great to have. And then I have some Pepto-Bismol tablets as well. Now moving up to the next compartment, I have a CPR mask. These are one of the small CPR face shields. They're talked about maybe not as useful anymore, where hands-only CPR has become more prevalent, but I still think it's a good thing to carry. And then some sunscreen. Sunscreen has many uses. Mainly this is a comfort item that I just keep on me at all times, especially when out working in the sun a lot, and during summer really comes in handy when you forgot your sunscreen elsewhere and are pretty afraid of getting burnt. Then you have your antiseptic spray. I like it. It has varying, people don't always say it works. I like using it, but go off of what you think. It's just nice to help clean off cuts and bruises that I get. Then duct tape. This is duct tape. Well, I guess this is Gorilla Tape that's wrapped around a credit card, or I guess this is a gift card. I like how this comes, and this is in my medical kit and my outdoors kit. I like rolling it up like this. It comes in a form factor, and you still get your duct tape. Duct tape can be used in a lot of situations for medical, like blisters. I particularly like it for blisters and also securing some dressings. But mainly that's for practical uses and just fixing stuff up around. In here, this is the boo-boo pouch, I guess, the Band-Aids and the other stuff like that. We've got a little, this is a 2x2 gauze pad, some bigger Band-Aids. We've got some waterproof Band-Aids and some bigger dressing Band-Aids, like butterfly Band-Aid there too. Some smaller Band-Aids as well. Then we've got burn gel, a triple antibiotic ointment, an anti-itch lotion, and some Tylenol for your fever reducer, stuff like that. That all came in this little pouch. And last 2 things, I have Celox Rapid Gauze. This is a hemostatic gauze that came in this kit originally, but I like to keep it in here just for my big worst case scenario. This is the thing that I need really quickly, and a lot of the medical professionals that I watch on YouTube, as well as from my own EMT experience, that if I need something really quickly, this will probably take care of it if the rest of it doesn't get to, until I can get to some more definitive care. stuff like that. So Celox Rapid Packing Gauze. And lastly, I have in here, this is a little like fire starter magnifying glass, but it can also be used for looking at splinters and stuff like that in a cut. Which reminds me, I forgot the first pouch on this. There's a little Velcro pouch and a little flip back here. I don't have anything back here, but you could put something there. Up here I have a pair of tweezers for removing splinters and removing ticks. And that's the pair of tweezers that I use. And it's a little attached in here so it doesn't fall too far down with a bit of paracord stuck in the Velcro. Alright, that's it for my little Maxpedition pouch that I carry on me most of the time. Alright, so now my bigger kit. This bigger kit is what usually lives in my car, or when I combine it with my smaller kit, what I take on backpacking trips, what I took to sea base, and what I also used as my response kit while I worked first aid at a Boy Scout camp. This kit is originally from Live the Creed. They're a great company, not sponsored obviously, but I bought their kit because it looked really good and it had all the needed supplies for trauma, but also the minor supplies for a everyday medical kit that you need with a bunch of Boy Scouts, honestly. But it has that double capability. I really liked it. And then I went through and basically took some stuff out, put some more stuff in, and now have made it my own, which is generally what you do with a first aid kit, is you make it your own. So first off, the outside of the kit, it comes with 2 MOLLE clips, and I've used that to MOLLE it onto my backpacks and stuff like that. Great things, and I've also used it to MOLLE some other kits. Over here you have a tourniquet. Some people will yell at me for the way that I set up my tourniquets, but this is how I prefer to set it up. I have the time across the front because it preserves the Velcro better in my perspective. And it's wrapped up so I can quickly pull it and put it over a leg or an arm, or undo it if I need to slip it under a leg. But tourniquets, definitely good, and there are way better than any improvised tourniquet that you can make. Some people may say otherwise, but that's not necessarily true. And this is the cat tourniquet, and definitely one I recommend. Alright, so over on this side I have 2 medical tapes on this little like ring that you put on a trailer. I saw some ski patrollers use it, and it seemed to work really well for them, and it's worked well for me so far. So I have Coban on this side. This is great for attaching dressings and stuff like that. And then I have medical tape for when this isn't sticky enough to reattach the end of it, because this provides some like pressure where this doesn't really, but this is more sticky. Alright, moving on to the main part of the kit. This kit clamshells open. To provide 2 sides, we have this little like loop side, and then we have the more the see-through side. There's also a zipper on the outside to get through the see-through side. In the center, we have 2 gloves. They are just, I think they are from North American Rescue, and they're some pretty heavy-duty gloves right here. So they're both they're brown, which I prefer over the black, because when you do a blood sweep, you can see the blood on your hands, and that's kind of the whole point of a blood sweep. I have a tick remover. I don't necessarily like tick removers, but if you use them and you know how to use them, I recommend keeping them in your kit. Personally, I just prefer using tweezers, but still a good thing to have in your kit, especially while you're venturing into the outdoors. I have a little sleeve of Tums, or 8 chewable tablets, just for like some gut issues if you want to use that. And another pair of gloves, same ones as these. In here, additional thing with the gloves, make sure that they fit. I think these are larges, they obviously fit me, but if you are a small or a medium or even an extra large, you might want to take these out and replace them with your own gloves. Over on this side is also more of the trauma side, so keep that in mind while I go through it. This is the North American Rescue emergency trauma dressing. It's basically a rolled compression trauma pressure dressing for your extremity wounds and stuff like that, anytime you'd use a trauma dressing, and I think this one's a pretty good one. I also have some aloe, great for sunburns, and yeah, that's basically what it's for, but good to have in a kit, especially when you're working outdoors. Over here I have the SWAT T tourniquet. Some people don't like them very much. I think they're great, but mainly as a pressure dressing. Since I already have the cat tourniquet, I don't necessarily need another one unless there's something really bad's gone on. But so I use this as a pressure dressing with a gauze pad or an abdominal pad, and put that on as another pressure dressing. Down here I have some NAR Responder combat gauze. Here I have some NAR Responder compressed gauze, and just a great another thing for wrapping and packing as your gauze. This kit comes with 2 of them. I took one out and put it in a different kit. Additionally, this is where the Celox gauze came from, so you get Celox gauze in this as well, but I have it in the other kit, and when I move it over, it's obviously in this kit. Here I have this is a little like bandana type thing, but it has some pearls on the inside that are supposed to get cold when they get wet. I've used this a few times, and it seems to have worked, but mainly just getting something wet and putting it on them can help them cool down. So mainly just used as that. It can also be used as a sling or swath, so additional multi-functions. Here I have some vinegar. This was left over from my sea-based adventure. They say that you can use vinegar for jellyfish stings. The new literature out that is just soak it in warm water, so I'd recommend doing that. However, vinegar also probably has some merit to it, so I have it in there. Probably going to take it out soon because I don't really have to worry about that much, but good thing to have for sea-based adventures and ocean-side adventures. Additionally, we have some Advil in here. This is one of the little Advil cases, great for storing your Advil, and I like it. Keeps it dry and stuff like that. Here are some more Tums. Don't necessarily need both of them, but I have it in here because I forgot to take one or the other out. But good to have. So that's it for this part of it. And then on the back, it also has some more advanced options. I believe this is if you go with the Pro Kit and it doesn't come in the non-Pro Kit. So these are some more advanced, but still basic life support items. These are some, per se, EMT items that I know to use from my EMT training. So you've got a NPA to establish an airway, a nasopharyngeal airway. We also got a dual hyphen chest seals for any sucking chest wounds. I wouldn't necessarily recommend getting this if you don't know how to use them, if you don't have proper training to use them. You could possibly even get in trouble if you use them and don't know how. So stick with your scope of practice, what you know, but also train to be better. Last, we have a splint. Last on this side. This is similar to a SAM splint, but it is not a SAM splint. Great semi-hard splint. All right, moving on to the other side. Quick and easy access from the outer side. I have a boo-boo pouch. So this is obviously the main thing that I'm going to be using because, you know, basically just your ouchies and your medical stuff. I've got more Pepto-Bismol. This is Pepto-Bismol tablets. Some Benadryl. These are gel cap Benadryl, same as my other kit. And these are just for easier access. I've got some 3 of the anti-diarrheal tablets. In here I've got some, this is Tylenol, but also cold medicine, so it's a mixture of 3 medications. It's a cold and flu medicine, essentially. Because I'm not necessarily as familiar with this type of medication, I took the directions off the back of the box and put it on the back. I'd recommend for someone who's not as familiar with this type of medication, or any type of medication to cut the directions or just the stuff like that that you need to know, and put it on the back of the pills if you're putting it in a first aid kit like this. Some more things in here. We have some steri strips. So these are used to close a wound. I have a CPR mask, a smaller CPR mask. I like them more accessible than this. That's why I have one on my person and on my keys. But another great one to have for some more redundancy. I've got some smaller bandages, some band-aids, some waterproof band-aids as well. A bigger band-aid, along with more of these bigger band-aids in here. Some alcohol wipes, antiseptic towelette, and some alcohol cleansing pads. Some Tylenol, some burn gel, more of the antiseptic towelettes. Another Tylenol and a tampon. Tampons are definitely good for, obviously, what they're meant to be for females with their periods, and sometimes they don't always have one on them, so it's good to have one with you. Additionally, it can be used for nosebleeds. However, they're not always recommended for that. I recommend doing other things before you get to stuffing a tampon in your nose. Lastly, the myth where they can be used to treat gunshots is not necessarily true. It's just filling the space and not really providing much pressure and the stuff that you need to stop massive bleeding. So keep tampons out of gunshot wounds and basically where they belong. Last, this is some little packs of reusable covers for this thermometer. And that's good for whenever you're not just going to be using it on your family, for when you're on crew trips and stuff like that. I got this thermometer at just a Walgreens. I like the oral thermometers better than a forehead thermometer. It just gives a more accurate reading. Moving on to more of this stuff, I have some chewable aspirin. Definitely recommend chewable, because that means they don't have to swallow anything big, and that can be sometimes a concern. Additionally, aspirin's good for anything that has any heart issues, and I recommend you keep it to heart issues, chest pain, and stuff like that. It's not very good as a pain reliever. That's been kind of defunct. Yeah. Then we have a triangular bandage. These are for your splinting and your swathing. Splinting, slings, and your swaths. Just a great thing to have. And I swear that these can be used for basically most of the bandaging that you need. If you have just a bunch of these, you could get a lot done. Here we have an ace bandage for some of your sprains and strains on ankles and extremities. Great thing to have. It can sometimes fall apart, but good thing to have still. Now I have some big abdominal pads. These are for more of your trauma and bigger bleeds. You can just stick them on there and put them with the pressure dressing. Get that bleeding to stop. Yeah. Here we have a survival rescue blanket. Always a wonderful thing to have, especially in your outdoors environments. Shock is a main concern with trauma and in austere environments, so recommend having a survival blanket in your first aid kit. All right, some more random things. We got some first aid antibiotic, basically your off-brand Neosporin. Good for especially your outdoors cuts and scrapes, and can provide some way of antibiotic and cleanliness there. Some eye drops for eye irritation. A lot of times in the outdoors you get a lot of stuff in your eye. You can get some sticks and twigs and sparks, and additionally when you're around salt water your eyes can get irritated, so always a good thing to have eye drops. some Benadryl relief stick. I swear by these. These are great for all of your mosquito bites. I live in a place where there's a lot of mosquitoes, and I don't like them very much, so I think that this is a great thing to have. When I went to Philmont, I used this basically every night to cover up all those pesky mosquito bites, and I think they are great. Some last things in here, we have mainly just our gauze pads. So I've got some 2 4x4s, 2 3x3s, I believe. Yeah, so another 4x4, another 3x3, 2 2x2s, and an iPad, which could also be replaced by a 2x2. So just some gauze pads to stop some bleeding, to cover up some stuff. Also, just your mainly first aid needs. And moving on to the last stuff in here, we have a blister relief pack. In this blister relief pack, I haven't really added anything other than a little swath of little thing of moleskin. I don't necessarily like moleskin as much as I like using duct tape on my blisters, but still, these are great. They have some specially curated bandages specifically for blisters, and great to look at. I think a bunch of like outdoors companies have like little blister packs like this. And some last random stuff we have are my Sharpie for writing on the tourniquet, a pen light for assessing pupils and other vitals, stuff like that. Make sure that yours works every so often, and they might be a little finicky, but this one does seem to work. And a glow stick. Glow sticks are great for marking trails, marking casualties, patients, basically, stuff like that. Always good to have a glow stick, and just to look over your area. If you want to keep your first aid kit illuminated, crack it, throw it in the little center, and you got now your first aid kit at least able to be seen from a little bit farther away. All right, so that's it for this main kit. Thank you for watching my video about my first aid kits. If you have any questions, make sure to leave them below, and I'll see you next time. Bye bye for now.